Hello and welcome to the Machinist News Network. I'm Deirdre Kiniewski. It's almost impossible to talk about good jobs and wages without mentioning health care. That's why everywhere you look, someone is trying to come up with a solution. Whether you are running for president...
Are you ready for a president who will lead on universal health care so we provide quality, affordable health care?
Worried about the future.
I represent a whole group of guys, a lot of them a lot younger than me. They got a lot more time left. They need a good, decent wage. They need raises. They need health care.
Or just want what's fair.
We're tired. We're tired of the race to the bottom in our industry and all the jobs that have been lost and the loss of benefits, medical, the erosion of the entire work environment.
Everyone is talking about health care, and for good reason.
Peace of mind is something that is escaping so many Americans when they do not have health care or health care is unaffordable. We have 46 million Americans who have no health insurance. Another 50 million Americans are underinsured. Let me tell you, this is a defining economic issue in our country.
If you hold a union job, you've probably spent countless hours at the bargaining table talking about this issue. That's time that wasn't spent talking about things like safe working conditions and retirement. While John Edwards was one of the first Democratic candidates to come out with a health care plan, he wasn't the last. Now they all have ideas, none of which come cheap.
The cost of my plan is $90 to $120 billion a year, and I pay for it by getting rid of Bush's tax cuts for people who make over $200,000 a year.
Everyone knows that health care is an expensive endeavor. That's why so many are pushing for a universal plan. But the only way to make that happen is to involve everyone who has a horse in the race. That includes organized labor, healthcare professionals, and corporations.
To bring together unions and businesses, Democrats and Republicans, and to let the insurance and drug companies know that while they get a seat at the table, they don't get to buy every chair.
This is exactly what organized labor has been doing for years.
It's a national problem. It's not a problem for Massachusetts. It's not a problem for California.
President of AFSCME, Gerald McEntee, shared his thoughts recently at a forum produced by the D.C.-based think tank, the Brookings Institute. He says his members want a national plan, and for him, the best solution is one that includes employer mandates, the public sector, and workers sharing the cost. But his initial concern is to make sure those who gave up so much don't lose what they've worked so hard to get.
The other track, and the one that is probably of more concern to our people, although naturally, in their heart, they want everybody covered with a health care plan that works. But they are, I think, even more concerned with the fact of what's going to happen in this to their health care plan.
And as always, the IAM plans to stay its course for fighting for good jobs, because in essence, that means fighting for good health care.
I want to talk about jobs for people, good jobs, with health care benefits, and with a good, solid, reliable pension plan. And I want to talk about an expanding job base in America, not one where we trade it away. I think that's what America's hungry for, the real issues about America.
The numbers are frightening. In 2006, more than $2 trillion was spent on health care. Workers are now paying nearly $1,100 more in premiums than they did just 7 years ago. For more Machinist News, you can log on to goiam.org. Thanks for watching.